Hi, and welcome to this demonstration of a head-to-toe assessment. We'll start off by washing our hands. Wash, wash, wash. We'll introduce ourselves to the patient now. Hi, I'm Sterling, I'm a nurse practitioner student. I'm going to be doing your exam today. What's your name?
Stephanie.
Very nice to meet you, Stephanie.
Nice to meet you.
So, we'll start off by inspection and palpation of the skin. I'm going to be looking for color and texture, upper extremities, trunk, lower extremities. I'm looking anterior, I'm looking posterior. Everything's good there, no lesions, no edema. Let's go ahead and check out skin turgor. You pinch up a little bit, make sure that we have no tinning. I'm going to assess for temperature of the backs of my hands. Everything's good there. Let me take a look at the nails now. Looking at all the nails, going to check for cap refill, make sure that everything is pinking up nicely within less than 3 seconds. Also, I could take a look at the angle of the base of the nails. Get you to put your fingers together like that. Awesome. We're just checking for clubbing there. Everything looks good. Going to go on and move to the head now. What I'm going to do is I'm going to palpate the hair, feeling the texture. I'm going to inspect the scalp by parting the hair in at least 2 places, looking for any scaling, lesions, nits, things of that nature. Alright. I'm going to palpate the skull as well, feeling for contours and deformities. I'm going to palpate the face, palpating maxillary sinuses, palpating the frontal sinuses. Everything is good there. I'm noting the, TMJ as well. I'm going to palpate right in front of the auricles. Alright. That's good. No swelling, no tenderness. Let's move on and we can check facial sensation now. I've got a cotton whisk here. What I want you to do is close your eyes and tell me when I'm touching.
No. 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 No.
Alright. That's good. We're assessing cranial nerve number 5, trigeminal, when we do that. From there, we can go on and inspect the neck for symmetry and swelling. I'm going to be looking at the trachea as well. I'll palpate right in here, noting that we have a symmetrical space between the trachea and sternocleidomastoid. There's no tracheal deviation. Everything feels good there. Carotid pulse. Palpate one at a time. And I'll go ahead and auscultate for carotid bruise. Using the bell of the stethoscope. Okay. Everything sounds good there. Let's go on and palpate the lymph nodes now. So I'll palpate preauricular, posterior auricular, occipital, the tonsillar, submandibular, submental, posterior cervical, anterior cervical, and clavicular. We move around to the back here and go ahead and palpate for the thyroid, right under the cricoid cartilage, feeling on either side, noting symmetry, and making sure that we don't have any enlargement. I can also palpate or auscultate for carotid bruit with the bell of the stethoscope. Very nice. All right. So, let's go ahead and do range of motion. What I want you to do is touch your chin to your chest. Okay, she's got good flexion. Look up at the ceiling. Good extension. Ear to your shoulder. Other shoulder. Good lateral. Can you look over your shoulder either way? Perfect. And she's got good rotation as well. Alright. Now let's move on to the eyes. So what I want to do is get my Rosenbaum chart out here. We're going to assess cranial nerve number 2, the ocular nerve for visual acuity. I'm going to hold it about 14 inches in front of you. Do you wear glasses?
Nope.
All right. So what I want you to do is cover one eye and then read the smallest line you
A-E-I-O-U.
can. Now cover the other eye, read the smallest line.
A-E-I-O-U.
Very good. Now with both eyes, read the smallest line that you can.
BMW XY.
Great. Okie dokie. So I'm also going to be looking at the eyes themselves, inspecting. I'm looking at the eyelids for alignment. I'm looking at the eyelashes. Okay. They've got good alignment. Also looked at the sclera. There's no yellowing. I'll look at the conjunctiva. Right. They look healthy. I was noting the lenses as well. I'll get my pen light out here, and we'll look at our corneal reflexes, our pupillary reflexes. That's what I meant to say. So I'm going to check for direct constriction. Shine the light in there, look for the constriction in the eye, and then the consensual response. Shine the light in one eye, but I'm actually looking in the eye that doesn't have the light shining in it for constriction. So let's go on and test the extraocular eye movements. This is assessing cranial nerve number 3, 4, and 6. What I want you to do is follow my finger, okay? Keep your head still and just follow my finger with your eyes. Awesome. Alright, and if we had any defect there, we could check the nasal field, get you to cover one eye, and then tell me when you see my fingers moving.
No.
Alright. That's how we would assess that. We'll also do the visual fields by confrontation. Get you to keep your head still, look forward at me, and tell me when you see my fingers moving.
No. 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 No.
Alright. Very good. We'd actually do the nasal fields after that if we suspected any kind of defect. So, let's go on and assess cranial nerve number 5 again with the corneal reflex. Have you look forward and gaze up and away from me, okay? I would approach with my cotton wisp from the side, see if we elicit the blink response, letting us know that number 5 is intact there. Okay, let's go on to the ophthalmoscope exam. I just so happen to have it right here. Dim the lights, turn it on. I'm at about a 15-degree angle. I'm going to look at the right eye with my right hand and right eye. All right. I see the red reflex. Now I'm moving in, adjusting my focus, and I'm looking at the optic fundi. I'm noting the retina, I'm noting the fovea, the macula, and the optic disc. Excellent. So, I think we can go on to ear, nose, and throat now. I'm going to look at the ears first. So I inspect and palpate the auricle anterior and posteriorly, feeling for any deformities, any lesions, making sure that the ears were symmetrical. Let's see. Let me go ahead and switch over here, and we can do our otoscopic exam. So what I'm going to do is I'm going to come, for an adult, I'm going to pull up and away, and I've got it on here. I'm going to make sure that I brace with this hand so I don't go in too far. Alright, and then I'm going to be inspecting the ear canal. I'm going to be noting all my landmarks on the tympanic membrane. I can see the malleus, I can see the incus. No inflammation there, no perforations. If I had my little pneumatic piece, I'd be able to check for mobility. Okay, well, let's go ahead and test out the acoustic nerve, which is number 8, cranial nerve number 8. We're going to be doing the whisper test. So what I want you to do is occlude this ear, and then I'm going to whisper something. I want you to tell me what I said. Okay?
Football.
Good. Do the same for the other side.
Baseball.
Awesome. All right. So then we would get our tuning fork out and test for lateralization of hearing. This is going to be the Weber test. What I would do is strike the fork. I'd have the U facing forward. I'd make sure that I didn't touch the fork. I'd place it on the top of the skull, and I'd ask if the patient heard the vibration equally in both ears, which is normal, or if it lateralized to one ear, indicating that we had some conductive hearing loss. So then we would do the Ryan test, where I'll do the same. Strike the tuning fork. I'd hold it right behind the ear on the bone here, and I would tell the patient to tell me when they stopped hearing vibration. Then I would move it to the side of the ear and tell them to tell me when they stop hearing vibration as well. And the air conduction should be twice as long as the bone conduction for a normal result of the Ryan test. Alright, so let's keep moving. Let's go to the nose now. I'm going to inspect the patency of the nose. So what I want you to do is occlude one nostril, breathe in, okay, do the same. Alright, so we're nice and patent there. I'd get my scope out again and take a look inside the nostril, noting the lower turbinates, noting the septum for any perforations, deviations, and I'm also noting the mucosa. Alright, everything looks good there. No discharge, anything like that. let's see, let's go on to the mouth now. I'm going to inspect the lips. I'm going to inspect the buccal mucosa and the gums and the teeth. So go ahead and open your mouth for me. Alright. And pull your lip down. Good. I was also looking at the oropharynx and the tonsils and the uvula when I was shining my pen light over. Okay, so let's see. I could test the reflex, the gag reflex there. That would assess cranial nerve number 9 and number 10. We won't do that today. Let me see. Open your mouth again and say ah. Okay. So I saw movement of the uvula there. That is a good indicator of intactness of cranial nerve number 9 and number 10. Let's keep moving. I think we can go on. Move down to the chest and lungs. So what I'm going to be doing is I'm going to be inspecting for symmetry. I'm going to be looking at the anterior and posterior to lateral diameter, and I'm going to be looking for accessory muscle use with respirations as well. So I'm looking anterior and posterior. It's a nice 2-to-1, that's normal. I'm not seeing any accessory muscle use in the clavicles and sternocleidomastoid. Lets me know that she's not under any distress. I'm inspecting the rate, I'm inspecting the rhythm, I'm inspecting the effort of breathing as well. Let's see. What else? Let me go ahead and palpate. I'm going to be palpating for crepitus and any kind of tenderness. Okay. Everything feels good there. Let's see. Can I get you to stand up and turn around for me? We're going to assess respiratory expansion here. I've got my hands at the CVA here, and I'm going to pinch up a little skin. Just get the patient to take a breath for me in and out. And I'm looking for symmetrical expansion with my thumbs. Go ahead and have a seat. Let's see here. I think I can go ahead and do some more palpation. Palpate tactile firmness now. I'm going to be using the edges of my hands. Can I get you to say 99?
99, 99, 99, 99.
All right. Can you turn around again? Stand up. 99.
99, 99, 99, 99, 99, 99.
Okay. From there, I'm going to go ahead and palpate for diaphragmatic excursion. Could you stand up again? So what I want you to do is just breathe normally now. I'm finding the change from resonance to dullness about right here. So that gives me my baseline. Now I'm going to ask you to take a deep breath and hold it. Palpating down. Okay, we're going from resonance to dullness again. I've got those areas marked. And what I'm going to do now is tell you to take a deep breath out and hold it. And I'm palpating up. Alright. Until I hear the change from dullness to resonance. That lets me know that I've hit the diaphragm again. So, what we're going to do now is we are going to auscultate for breath sounds. We're going to do this in a ladder pattern. Take a deep breath in and out. In and out. We'll do it from the posterior as well. You should stand up and then turn around. And in a ladder pattern, get your breathe in and out. In and out. Okay, very good. So, let's move on and go for the heart and vascular system. So we'll inspect for heaves and pulsations of the chest. I'm going to inspect the peripheral veins and arteries. Everything's looking good. I'll be inspecting the neck for any JVD. I tilt the patient back at 45 degrees. Let's see, inspect. Let's go on. I've already palpated the temperature of the extremities for warmth and edema. Palpated for cap refill already. I'd also be palpating for any thrills, pulsations. I'm going to be palpating for the PMI, which is going to be around the fifth intercostal space, left mid-clavicular. Okay, I do that with one finger. Let's see. I palpated and auscultated the carotids. I'll palpate the radial pulses. Okay. Palpate the popliteal behind the knee, and palpate the tibial, which is behind the malleus, and palpate the pedal pulse, which is on top of your foot. Okay. Let me go ahead and auscultate the abdominal aorta. This is about midway between the navel and the xiphoid process. Okay. From there, I would do the iliac. The iliac are about 2 inches below the navel, in line with the femoral pulse. The renal are about 1 inch lateral of the aorta. And then the femoral pulse, of course, in the groin. So, I think that takes care of all of our pulses. I would palpate all those areas as well as auscultate them. Let's see. Let's go ahead and auscultate our pulmonic areas. So I'm going to find the second right interspace. This is the aortic. Across from that is the pulmonic. Below that, on the left sternal border, is the earth space. And below that is the mitral. Okay. Let's see. Let me go ahead and start with upper extremities. What I'm going to do is palpate the joints, the shoulder, feeling the bony aspects, tracing up the shoulder or scapula to the acromion, the coracoid. I'm going to feel the medial and lateral epicondyle, the olecranon process. Feel in between the medial epicondyle and the olecranon for the nerve there. Work on down to the wrist, palpating the joint space on the other side of the wrist, all of the carpals, and the hip joints, and dip joints. Okay. So I've inspected and palpated all those areas. We can go ahead and test the range of motion with the hands and the wrists. What I want you to do is go ahead and flex and extend the wrist for me. Let me see your radial deviation and your ulnar deviation. That's good. Flex the elbows, extend the elbows. Let me see, pronate and supinate. That's good. Okay. Let's see. Let's do range of motion with the shoulders. I'll get you to flex the shoulders and then extend, reaching out behind you. Let me see your abduction and external rotation by scratching the back of your neck. That's good. And we're going to look at adduction and internal rotation by scratching your shoulder blade like that. So that's good. Let's go on and we can test out muscle strength now. For the muscles of the shoulder, what I want to do is get you to just raise your arm out, hold it, and then slowly bring it down. That's the drop arm test. Or we could have you hold your arm straight out, thumbs down like that. Put some pressure on them. That's the empty can test. That's checking out the supraspinatus strength. We can check out the infraspinatus strength by go like this, and then I want you to try to force your hands out while I put some pressure on. Yeah, that's good. All right, we'll check out supination and our supination strength. Get you to turn your hands like that. I'm going to grab your wrist and put internal rotation on. I want you to try to turn it on. Oh, wow. All right. So let's go ahead and we could also do a special test here. We'll do the Phelan sign to check for carpal tunnel. What I want you to do is put the backs of your wrist like that. Okay. That's good. That's good. Let's check for strength now with the elbows. What I want you to do is try to push me away. Try to pull me towards you. Alright, so we got good flexion and extension there. Let's check out the strength of the wrist and cock them up. Cock them up like that. And don't let me push them down. Good. Okay. Check out hand strength. I want you to squeeze my fingers and don't let me get away from me. Oh, yeah. Okay. So we're all good there. I think we'll go on and check out the abdomen now. So what I want you to do is lay on back. And you got your hands at your sides, got your knees up. Alright. First we'll start off by looking. I'm going to inspect the contour down on the level, noting whether it's concave or convex, or rounded, scaphoid, or just simply flat. Let's see. I'm going to auscultate in all four quadrants. I'm noting vowel sounds there. I'm noting the frequency and the characteristics of the vowel sounds. I already auscultated the aorta, the renal, the iliac, and the femoral arteries. I'm going to go ahead and do some percussion then. I'm going to do this over 9 areas of the abdomen. Alright. And just assessing for resonant and dull sounds when we do that. Let's see. Let me go ahead and percuss the liver border. So I'd start at the right mid-clavicular, under the nipple, percussing down. When I hear dullness, that's the superior aspect. In line with that, at the navel, I would start percussing up. Until I hear dullness again. That lets me map out the borders of the liver. Let's see. Let me go ahead and palpate or percuss for spleen enlargement, splenomegaly. Get you to get this over your head like that. So we're on the anterior midline at the lowest intercostal space. I'm going to palpate, or I'm going to percuss, and then I get the patient to take a deep breath and hold it. And if I heard a change to dullness, that would be an indicator of some splenic enlargement. Let me go ahead and percuss for some CVA tenderness. I do this with fist percussion. Can I get you to stand up, please? And turn around. So over the CVA, I just do some fist percussion. And I'm assessing for tenderness there. Let's see. Get you to lay back down for me. And I'm going to do some deep palpation now on the abdomen. I'm going to be going about 1 to 2 inches here. Using 2 hands. Feeling for any masses and any tenderness. Noting any kind of guarding that they would be having. Let me go ahead and palpate the spleen. So I reach across, push up with this hand, and I'm palpating upward with my opposite hand until I get to the lower costal margins. Get the patient to take a deep breath, hold it, and I'm going to try to feel the lower border of the spleen. Or liver, I should say. Now we'll do palpation of the spleen on this side. So I'm pressing up, feeling palpating upward to the costal margin. When I get there, I'm going to get you to take a deep breath. Alright, I'm trying to feel the border. With the kidneys, I do the same thing. They are bilateral on the midclavicular line. Okay. Let's see. Done liver, done spleen, done kidneys. Let me go ahead and do a special test now for appendicitis. This is going to be the arbiter sign. Get you to push your legs straight out. And what I want you to do is try to flex your hip, your right hip, against the resistance I'm going to put on you. So go ahead. Okay. Any pain?
Nope.
Okay. If she had pain, that would be a positive arbiter sign there. So we've done the upper extremities, we've done the abdomen. Let's go on down to the lower extremities. I'd inspect the joints, the hips, the knees, and the ankles and feet. Let me go ahead and inspect and palpate those areas. Okay. So the iliac crest, the anterior, superior iliac spine. On the back side, the posterior, superior iliac spine. The greater trochanter right here. Palpate the joint space on either side of the tendon, the patellar tendon. I can palpate the condyles of the femur, the plateaus of the tibia. Trace the patella, or the patella, and feel down the patellar tendon to its insertion on the tibial tuberosity. I'm feeling for any kind of swelling, bogginess, boniness, all that good stuff. On the ankle, I'm going to be palpating the anterior joint space. I'm going to be palpating the medial and lateral malleolus. Palpate the Achilles tendon for any nodules. The posterior and inferior calcaneus. And palpate the fascia on the bottom of the foot for any tenderness. Palpate in between the metatarsals. Palpate at the metatarsal phalangeal joints. Give a little lateral compression to see if we had any tenderness. I think we're all good there with our inspection and palpation. You go ahead and have you sit for a second there. So let's go ahead and check out some range of motion. What I want you to do with your knees is, extend them out, good extension, take them back, good flexion. We could assess this by getting her to stand and do a squat in place. But what I want you to do is like that. Okay. So we're going to test hip flexion. So that's good. We're going to check hip adduction, hip abduction. External rotation, internal rotation. That's good. We had flexion and extension of the knee already. And we go down to the ankle. Can I get you to press down? That's plantar flexion. Go up. Dorsiflexion. Cocking the heel in. That's inversion. Cocking it away. That's eversion. Lateral and medial rotation. All that looks good. Let's see. Okay. Let's go ahead Let's do the spine now. Let me get you stand up and turn around. And I'm going to inspect. I want to make sure that the spinous processes are in a straight line from C7 down to the gluteal cleft. Let's inspect that the shoulders and hips are nice and aligned while she's standing, and then also when she's flexing, touching her toes down like that. Okay. I want to palpate for any spinous tenderness. I want to palpate the intervertebral muscles for any tenderness, any tremors that they're having. I would palpate the sacral joint down here for any tenderness. I go ahead and do some fist percussion down the spine for any tenderness. Let's do range of motion then. So you did flexion for me. Can you do extension like this? Lateral bend. Other side. And rotate. Cool. Let's see. Let's do a special test. Let me get you to lay back down again. And since we're talking about the spine, we'll go ahead and do the straight leg raise test. Where we just raise the legs up straight. And any kind of pain that she had within the first 10 degrees, that would be indicative of some spinal nerve involvement. Alright, so let's hit the cranial nerves, all the cranial nerves. Go ahead and sit up for me. So we've done a few of them already. I want to make sure that we get the other ones. So number one, cranial nerve number one is the olfactory. I know that her nostrils are patent. Let me get my sense out here, and I want you to close your eyes and include one nostril, and tell me what you see.
Vanilla.
That's vanilla. And do the same on the other nostril. Cinnamon. Okay. So we've assessed cranial nerve number 2, the ocular nerve, with the Rosenbaum and the confrontation test. Number 3, ocular motor. We did that. Number 4 and number 6 by following the finger. Number 5, the trigeminal. We did the sensation. We checked the motor aspect with the clenching of the jaw, feeling over the temporal and masseter muscles for muscle strength. Number 6 was also involved with the tracking. Number 7, which is the facial nerve. Let's check that out now. Can I get you to frown? Can I get you to smile? Will you show your teeth? Okay. Will you puff your cheeks out? Will you stick your tongue out? Okay. Can you raise your eyebrows? Okay. Can you shut your eyes? So tight that I can't pull them apart? Good. Okay. So that's our facial. Number 8, we did the whisper test to check out the acoustic nerve. Number 9 and number 10. Number 9 is the hypoglossal. That is soft palate movement. We saw that with the uvula. Number 10 also. We didn't do the gag reflex to assess those. Number 11, let's see. Number 10, I said hypoglossal was 9, and number 10 is the vagus. Number 11 is the accessory, the spinal accessory nerve. We'll test this by getting you to shrug your shoulders. Okay, now turn towards my hand. Okay, turn the other way. Good. We got good strength there. Let's see. I said 9 was the glossopharyngeal, and number 12 is the hypoglossal. So that was all about the tongue. Your voice sounds good, your quality of voice, everything's good there. Let me see, I want to be looking at your tongue just as it rests in your mouth. Okay, and now protrude for me, stick it out. Right, left, okay. I'm going to test the strength. Can you press against your cheek with your tongue? Yes. Good. Let's see. Now I want to go ahead and do some let's check your proprioception now. So with the big toe, I would grab it medially and laterally, move it up and down, ask the patient to tell me whether it was in the up or down position. So for the upper extremity, we'll do the index finger. I want you to close your eyes and tell me whether we're up or
Down.
down. Also for discriminatory sensation, we could do graphesthesia. I'm going to draw a number in your palm. I want you to tell me what number it is.
8.
It's an 8. All right. So that takes care of all of that. Let's do some coordination. Can you, quick as you can, back of the hands and palm, back of the hands and palm. Good. All right, and we'll also do some accuracy with point to point. I want you to touch your nose and then touch my finger as it moves, okay? Right. Should be good there. Let's check out our reflexes now. So we'll do the biceps reflex. The triceps reflex. The patellar. The Achilles. Alright, and the brachioradial. All that's good. Also, we would test the plantar reflex with the Babinski. We'd scratch up and medially see if we elicit that fanning of the toes. That's the positive Babinski. We don't want that. I observed her gait as she was walking in. Noting her stance, movement of her arms and legs, her balance, shifting of the hips. So let's do a couple more kind of special test. Let's do the Romberg. I'll get you to stand with your feet together and your eyes closed and your hands at your sides. And I'm just checking for any kind of swaying here. I'll make sure that I'm here to catch her. Let me get you to walk heel to toe as well. Just like that. Okay. Now turn around and walk on your toes. Good. And then on your heels. Perfect. I do believe that covers it. I appreciate your time and hope you found it informative.